Well, I want to welcome everybody tonight to Energize Your Life in Business. Everyone can use energy medicine for personal and professional results. And tonight we're going to have Dr. Dorothy Martin-Neville on, and she's a fantastic teacher of energy medicine. Our host tonight is going to be Michelle Demers. She's the founder of Resonate Inc. I'm a partner in that as well, and she's going to be hosting tonight with Dr. Dorothy. So, Michelle, if you want to get started in our webinar tonight, we'll go ahead and get people on board, and we can start learning more about energy medicine. So take it away whenever you're ready, Ms. Demers.
Great. Thank you so much, Colin. And hi, everyone. My name is Michelle. And as Colin said, I am founder at Resonate. And what we like to do is we like to bring talented folks, such as people like Dr. Dorothy, who have great things to offer the world, and interview and find out more about who they are and what they do. So, Dr. Dorothy, thanks so much for joining us tonight. I'm really looking forward to speaking with you.
Oh, you're so welcome. I'm excited about it myself.
As Colin said, it's Energize Your Life and Business, and how anything can use energy medicine for personal and professional results. So tonight we'll really be talking about more of an different life circle moments, because she has an amazing, so many other things. I'd love to share about Dr. Dorothy and especially her energy medicine credentials. Now, Dr. Dorothy, I know that you created and ran the school for IHAS, International Healing Arts and Sciences. Is that correct?
Correct. The Institute of Healing Arts and Sciences.
Institute, right. Sorry about that. Now, you had created and run that school for 19 years, correct?
Correct, yeah. It was a phenomenal place. We had a 2-year and a 4-year program, and it just was life-giving to myself as well as the teaching staff and the students who went through the program.
Absolutely, and as part of that, you actually became a clinical instructor of energy medicine at UConn, and we're teaching the medical students. Is that correct?
Correct. We went up and we did really hands-on work, letting the medical students experience what it feels like to receive energy medicine so that they could really more fully understand it.
And you also were the creator of your very own special methodology called the WISE method, which I know we'll be getting into a little bit later, but maybe you just, quickly touch on what that's about, because I know that's going to kind of be the core philosophy of what we're going to be talking about tonight.
Right. In the WISE method, there really is a major emphasis on how we live so multidimensionally, that we are physical beings, we are emotional beings, we are spiritual beings, and when you put all of those together and really work with the whole person, you get to work with so many different elements of what makes them them. You work with the energy from the chakras, the energy from the meridians, the energy from their entire personality, and learn how to understand how we all hold our energy differently depending upon whether or not we're feeling alive and vibrant or feeling like a victim and overwhelmed, and really holding our energy in tightly. It's a really inclusive approach to energy medicine.
Excellent. Well, I know one of the reasons that we're doing this webinar today is that you had closed the school 4 years ago to go into retirement, and since then you've been seeing therapy patients and doing life coaching and speaking and being out in the world, and you've had so many people ask you about your energy medicine work and wanting to know more about that. So in response to that, we've created this webinar so that you can answer those questions for people and give people at least some initial tastes and techniques and information that they can utilize in their lives, whether it's personally or professionally, in order to better themselves in that way.
For some of us, there's no such thing as retirement. Life just goes on and on. When you love what you do, you don't want to give it up. And so you just find other ways to do it that feed you.
Right, exactly. And great, we're moving on. We're going to talk about the field of energy medicine, kind of giving an overview, because energy at its core is really a part of everything and all of us. And so understanding energy is really understanding life, as it were. Would you like to talk about that a little bit?
Surely, understanding energy and energy medicine is really also understanding how you function, what makes you you. Because we all know so much about energy already, and yet perhaps don't necessarily think of it in those terms. There's already an educated starting point for everyone. We know when we feel sluggish. We know sometimes when we feel absolutely alive and vibrant and immensely creative. What most people don't realize is that every one of us has the ability to define how we want to feel. On those days when you're sluggish and down and depressed or overwhelmed, it's not that difficult, honestly, to get that energy flowing again. And this is energy medicine, which you can practice on yourself. To get that energy medicine, that energy flowing again, where you just take off, you're alive and you're vibrant. It's really an amazingly natural process. It's learning to understand how powerful it is, and also how powerful you are in regulating what you want to do with it. Energy medicine is many thousands of years old. It's been practiced in other countries for thousands and thousands of years, and thankfully came to the States, a few decades ago, and has become progressively more obvious for many people, because there are more and more techniques, more and more approaches to energy and energy medicine being developed all the time. Basically, what it is and what you need in this is understanding that everything in life is energy. Every thought you have, every feeling you have is energetics. And many of us have been trained to believe that we're not supposed to think a certain way or feel a certain way. And so when a thought comes up in you, and it could be something such as you're waiting in line at the grocery store and you're impatient and you just want to whack somebody in front of you. And you think, oh my God, I'm not supposed to feel that, I'm not supposed to think that. Therefore, you grab that thought or that feeling and hold it in, almost to pretend it doesn't exist. And you grab it and hold it, and literally what ends up happening, because it's simply energetics, is it creates almost something akin to an energetic cyst. And when you develop a pattern of judging yourself, judging your thoughts, judging your feelings, and you hold all of those that you believe you're not supposed to think or feel, you literally become an accumulation of all these energetic cysts. And over time, they begin to create physiological disorders. So understanding how you think and how you feel, having permission to feel and think anything in the world that pops up, it just is. It's not good or bad, it just is. And having permission to say, this is where I am today, or this is where I am at this moment. And just let it pass through. Take a deep breath, let it pass through, and it's gone. Then you can be grateful you've got the money to be in the store buying something. But if you get caught up in judging yourself, you end up creating an energetic and possibly eventually a physiological issue that needs to be dealt with. Self-acceptance is amazing, and it supports energetic health. When we don't have it, we need practitioners to come in and support the natural flow of energy, which flows from the feet to the crown and then back down to the feet in a complete circular motion, constantly flowing alive and vibrant when it's able to do what it's meant to do. It's simply when we hold, as I said as an example, when we hold it in, that we end up being stuck and creating difficulties. And sometimes you can go to an energy practitioner who will simply support you in releasing that block. But if you, which feels wonderful, but if you don't take a look at why did that block begin in the first place? Why did you judge yourself? And what is your pattern of judgment? Do you always judge when you do angry thoughts? Do you always judge when you get nervous? What do you judge about yourself? Then you can begin to understand how you set yourself up energetically to not be in the healthiest of places. To me, it's an amazing, exciting process that when you understand energy patterns, you understand so much more about yourself. And then you recognize energy medicine is simply working with somebody who has the ability to recognize those blocks and dissipate them so the energy is reabsorbed back into your body, allowing you to never truly develop any major disorders. You can hit them in the very beginning, deal with them, and let it go.
Wow, that's great. So if I understand you, what you're basically saying is that one of the core concepts and philosophies to energy medicine is that our energy and our thoughts actually can create the physiological issues that we have in our body, diseases, I mean even things like cancer, fibromyalgia, heart disease, issues like that, and by actually addressing the energy issues we could actually heal ourselves physiologically.
Amazingly, absolutely amazingly. I received grant funding at one point from the National Institute of Health to research my work, the method of energy medicine I created working with fibromyalgia patients. And I created an 8-week protocol working with both control groups and the treatment group. And what we did in the treatment group is begin to recognize the personality style that develops fibromyalgia. More times than not, it's somebody who, in the way they love, believe that it is their job to protect the people they love from all sadness, from all fear, from all anxiety, and work with them. And really, this person ceases to exist. Their whole function is about protecting others. When you go back and look at a new perspective on what it means to love, a new approach to relationships, we found that almost 87% of the patients we worked with no longer had fibromyalgia or symptoms of fibromyalgia after simply 8 weeks, by understanding when it started, the point of onset, and so forth, all a part of the WISE method.
Wow, that's so exciting to feel like that people can take charge of their own health and healing just
Correct.
through understanding themselves, their thought patterns, and making changes there. And so it sounds like
noticing
go
what goes
ahead.
on noticing what goes on when pain starts. There's always a precipitating factor when pain starts or when it worsens. What's the stressor you have in your life? We know now that stress is the major precipitator for disease and disorders. So what's the major stressor? What are the thoughts coming up? And there may be no real issues in your life at the moment, but that doesn't mean you don't create them in your mind. So understanding what are the stresses you're dealing with, you'll understand where that pain originated and how not to get that pain back.
Right. Let's talk a little bit about who can practice energy medicine, because I think when people hear the word medicine, they automatically think doctors, they think medical school, they think MD. They don't think that they themselves, if they don't fall into one of those categories, can actually practice energy medicine, and actually that couldn't be further from the truth.
Well, anybody can practice energy medicine. We already do. We instinctively, when somebody falls down, you instinctively want to pick them up and soothe them and make sure that they're okay. When you see somebody who is hurt, they got a cut, you instinctively want to hold that part of their body and support them in the healing process. It's a natural instinct for every one of us. We're born energy practitioners, if you will. Sadly, we've learned to have boundaries. We've learned to allow people to be on their own. I mean, how many car accidents do people just drive by and not intercede for fear of being sued, for fear of invading somebody's space, when instinctively we want to help? And so it really is bringing you back to what's a natural tendency, because everybody's called to practice energy medicine.
Right, and I know a lot of people that you work with, especially therapy clients or even coaching clients, they're really interested in this work because of how it can help them expand and grow in a personal growth way. And can you talk a little bit about how folks can really use this in order to enhance their own personal growth and development?
Oh, certainly. When you notice for yourself, when are you most fearful? And what is that fear about? It's generally about a belief system. Either a belief system that you're not enough, you're not good enough, or you can't do it. Notice what's going on, and this is simply paying attention to the the energy in your own body? When do you feel yourself clenching? When do you feel yourself really at peace and feeling alive and vibrant? Notice when you leave that alive, vibrant place, because that's where we're meant to be. That's how we are meant to live. So notice when you go into fear. Notice when you go into these different pieces that seem to betray who you truly are, whether it's sadness, whether it's grieving, anxiety, whatever it may be. And when you notice that, you really learn a lot about you. And you know, so many people say to me, I didn't think that bothered me, but when I stop for a minute and feel my body, clearly I'm so stressed about it, or I didn't realize how sad that made me feel. Now you have the ability to really take your cues for personal growth and development from yourself, from your own body. Really learning to tune in and listen to what your body is saying and how you're holding the energy gives you permission to understand things that maybe they shouldn't bother you, but they really do.
Right, and I know in a moment we're going to talk about more about the health and wellness practitioner side of things and how as a practitioner it's wonderful for you to be able to weave energy medicine in as part of your practice. So I know we're going to delve into that a little later. I'd like to move on to our next questions, where you touched earlier on the benefits of energy medicine. You provided that example about the person with fibromyalgia. There's other things, enhanced relationships, reconnection to that purpose and passion, and just overall happiness and satisfaction with life. I'm wondering if you could give some more examples of either how people have helped their physical health or relationships in terms of how they've utilized energy medicine to do that.
Oh, certainly. Something as simple as hemorrhoids. I had a patient once who was scheduled for surgery the next day because of a hemorrhoid situation that was so huge she could barely walk or sit down. And she came in to see me because she understood there's got to be another element to this than just physical. And when we looked at what was going on in her life, her son had just graduated from college and was going to work in the Peace Corps in Africa. And she really did not want to let him go. Literally, she did not want to let him go. And she thought that was perfectly normal. But when we talked about it and she saw how extensively she really was clenching everything in herself, not wanting to let him go. And when we could work through it and see his own natural growth, and he's been leading up to this since he was in elementary school, she could begin to laugh and enjoy this was her son becoming the man he was meant to be. Literally, she went in for surgery the next morning and it was canceled. It's things as simplistic as that. Also, patients, simple things, if you will, somebody undergoing chemotherapy and how horrific that is. When they can come in and receive a treatment, an energy medicine treatment, if they're strong enough right from receiving chemo, we can help balance the body, keep the chemotherapy focused on that part of the body where it's directed, and allow them to have minimal, if any, ramifications from the chemo treatment. There's so many things we can do with energy medicine by balancing out that body, keeping the healing where it needs to be, and allowing the rest of the organs and systems to function in a healthy way. In terms of relationships, when people know so much more about themselves, they are far less prone to dump blame or responsibility for what's going on inside of themselves onto their partners. When we don't understand us, it's easy to blame our partners for making us unhappy, blame our partners for making us stressed, when in truth it's really all about the stories we tell ourselves and understanding how those stories are impacting us, our own energy, so that we feel more defended or more aggressive rather than at peace with who we are, so that we can be truly present in our relationships. And when it comes to reconnecting to our purpose and our passion, when you learn to be at peace by recognizing when you're stressed and knowing the techniques to come back to peace and relaxation, you find a way to be so much more at home with yourself that literally you stop living in reaction to the outside world and start living in response to yourself and to the people in your life. That creates such a sense of happiness and satisfaction that life really seems like a wonderful adventure. Once it's an adventure, it is so easy to discover your purpose. Your purpose is what causes you, anything that causes you to wake up in the morning feeling alive, feeling passionate, like you just can't wait to get out of bed. sadly, in my experience, so many people are surviving this journey. They're not living it. So much of my speaking when I travel to speak or in my teaching is really supporting people to stop surviving this journey and start living it. And once they have permission to do that, and unfortunately many don't, they're so disconnected from themselves that they don't even know how to begin reclaiming their passion and their purpose, because passion and purpose go hand in hand.
Right. I love what you said earlier. I wanted to go back to when you were talking about the chemotherapy, and what came up in my mind was those who are caregivers to those who are ill, that this work could be so beneficial to them on so many levels, because they can help the person that they're taking care of by doing work on them, but they can also protect and renew their own energy and hopefully prevent themselves from getting sick in that process, and making sure they're not giving too much of themselves away.
Absolutely. When caregivers, unfortunately, some do that initially very lovingly, and some do that out of a sense of responsibility or moral obligation. After a while, for many who come from their heart initially, they tend to disappear. Their entire world becomes their patient or their loved one, whoever that is, and they cease to exist in their life. When that happens, depression, overwhelmed, and even bitterness and resentment can take place, because they've learned to stop listening to themselves and solely focus on the outside, on the other. So it really is bringing them back to a place where they can recognize who they are, recognize their needs and wants, and find a way to build self-care into taking care of somebody else. And when they understand that, they will find that they really go back with love and concern and a joy to supporting the person they are helping. Because there's a recognition we're all walking this journey, we're all going through what we need to go through to support our own spiritual development.
Right. I also had a question about relationships, because I know a lot of people have relationships with parents or siblings that go a long way back, and there's a lot of baggage, as they say. And have you seen people use energy medicine to understand their own feelings and energy, and how that can maybe even change those relationships that for so long may have been stuck or, having challenges?
Oh my God, I see this consistently. I see this consistently as I work with my patients. I see this as I worked for many years with my students, even with friends, taking a look at how when we hold on to anything, when we hold on to resentments, we hold on to angers, we hold on to anything, it ends up impacting everything, not just in our relationships, it ends up impacting us. Again, we go back to that level of self-awareness. What am I feeling and what am I doing? When we can get a grasp of that, we learn to reach out really from our heart and from our soul. We learn to reach out from who we are, but we need to understand who we are in the first place. We need to have permission to be human, and so many of us don't have that permission to be human. We expect ourselves to be perfect, and whatever it is we perceive perfection to be. And when we are so caught up in being perfect and we don't have permission to be human, one, we lose our sense of humor. Two, we lose an understanding of where are we on this planet? What are we all about? Who are we and what are we meant to do here? When we get that, we have a far greater understanding that my life is about living my journey. It's not about being in reaction to others. They are not the enemy. They are not out to destroy me. That my life is really about living my journey, and there is no enemy in that way. It shifts your entire way of approaching relationships, your entire way of approaching yourself and seeing yourself in relationships constantly, so that when you look at a sister or a brother or parents or whoever it may be, you don't see the enemy. You see some other wounded soul that's dealing or not dealing with his or her own issues. And you don't have to then be in reaction to them, which gives you far greater patience to deal with whatever is going on and not getting caught up in the story, not getting caught up in the drama. Because most family relations and long-term standing issues are really about people getting caught in the story or getting caught in the drama. Stepping out of the both of those and coming back to yourself allows you to see all of those folks from a very, very different perspective.
And it also must allow the other people to step out of that drama as well, because if you're not engaging anymore, you're not provoking their old reactions, and so it allows them to meet you in a new place, I'm guessing.
For the most part it does, but sometimes those other folks are so stuck in the story they can't let it go. The difference is they don't know how to relate to you because you're not keeping the tit for tat, you're not keeping the back and flow going. And so the relationship shifts simply because you don't choose to play the drama. Now, you have to be willing to accept that some people want to stay there. So it really does change the dynamic, but it can take, on your part, take all of the explosiveness out of it. So at least there's one less bomb being thrown into the pot when families get together.
Right, right. Well, it's so all-encompassing in how utilizing energy medicine can impact all aspects of life, from physical to spiritual to emotional, mental, relationships, health, happiness, all of that stuff. Let's talk a little bit about the practice of energy medicine, because I know those who signed up for the webinar and are listening in tonight, some folks are either already in the fields of health and wellness, chiropractic, massage, medicine, other health and wellness fields, and some people are considering it. And so let's talk a little bit about energy medicine and how someone already in health and wellness might be able to incorporate this into their practice, and maybe you could give a couple of examples of how they would do that.
Oh, certainly, because after 19 years and over 1,000 students, I've seen it all kinds of situations take place. Depending, I know for many physicians or nurses in a hospital setting, they can't implement a full hand-on technique. You know, there's techniques I've developed over 30 years, many techniques. They can't necessarily do those in a hospital setting because it's not approved. But simply by putting their hands on the feet of a patient or on the arm of a patient, if the practitioner, the medical practitioner, is at peace, they literally support that patient coming into peace, because the practitioner, the healer's energy is so much more powerful because they're healthy. They're more solid. They are in a much better place. By putting their hand on a patient, they can bring them right back into peace and into a calmer, better place to go. And this energy medicine training, especially in the WISE method, supports them understanding the need to ask what's going on in that patient's life, what other stresses are happening, what was going on when this particular issue developed. So they really can see the patient in a far more holistic way. I can tell you what that does is it makes the practice of medicine far more exciting, because it isn't just about medicine and disease or disorders. It's so much more about the individual. Many years ago, I was a chaplain at Hartford Hospital, and remember the surgeons would say to me, we have to go up to 726 to see the burn, we have to go see the heart patient, we have to go see the liver issue. When in fact we're not looking at the liver issue, we're looking at a patient there who has great stress going on in their life and they're carrying that in the liver. So we can really go in and see the individual who has so much happening in their journey, and simultaneously take a look at how that's being presented through the liver. So there's another practice of medicine there. For those who don't practice medicine at this moment, say psychotherapists or physical therapists, massage therapists, the understanding of energy medicine allows them again to work on a far deeper level, to really integrate so much more into their practice that allows them to truly be present to their patient, to take it to a far different level. It's an exciting approach to working with it. I've had students who were PT physical therapists and others who were occupational therapists, and their entire practice changed and became far more exciting because it's so individualized and far less rote. They're not dealing with just another shoulder issue. They're dealing with so much more, which makes your work exciting. And if your work isn't exciting, why are you doing it? What do you need to do to bring more of you into it? Because energy medicine as a business supplements and expands, and your reputation spreads. That this practitioner was so much more than I ever expected, and word of mouth is the best marketing tool out there.
Right, and the clients and patients must get so much more out of the work that the practitioner is doing, whether it's physical therapy, there might be healing faster, or chiropractic. Things can move better because the energy is moving better. So there actually is actual benefit from that standpoint to the clients of practitioners who maybe have used other modalities, but they're building in the energy medicine piece.
By building that in, they're expanding their abilities to connect to the patient, so the patient feels that much more seen. And we have seen in so much research, so many studies, when patient feels seen, and to the extent that a patient feels seen, they have that much more faith and trust in the practitioner. And that shifts the patient's energy to begin with, because there is a much deeper level of connection. They can take in the nurturance, they relax, and whatever healing modality the practitioner is using is able to go far deeper and be more sustained. It's an amazing shift in the practice, whatever theirs may be. And for those who don't even have a practice, this, and who want to think about an energy medicine practice, it is a whole other world. The students I have had who have energy medicine practices, it's changed their lives. It's really showed them who they have always been, and now have permission to own, and now have permission to be there to support others in various ways. However they do that, it may simply be with family, or it may be a developing practice. There's no end to what can happen.
Right. I was really touched when you were sharing with me how, people that wanted to learn more about energy medicine just for themselves, just for their own personal growth and development and healing, when they started learning more about it and they started doing it, they really felt called to it.
Right.
As a profession, and it was almost like, but through this self-learning, they realized that this is what they wanted to do, and they had something to give in this area. So maybe if you have a story to share about how somebody kind of found themselves on that journey, that would be interesting to hear.
Well, yeah, and I think it's only natural that when somebody discovers something wonderful that's life-transforming for them, they want to transform everybody else's life. I mean, this is a gift you want to share with the world. When you see how much it's impacted your own journey, you truly want to help impact the journeys, not just of the people you love, the people in your world, but anybody you can reach, anyone you can put out there. And I've seen it, numbers of patients or students who came in to say they just wanted to do this for themselves, even patients who've said, I just wanted to understand this for me and how I'm betraying myself, how I'm creating difficulties in my own life or in my own body. And yet once they got it, said, this is a reality. I could take this out here and change the world. I know for myself, I was really blessed. I was in private practice as a therapist. This was back in the early 80s. I was in private practice as a psychotherapist and was blessed. I had 42 patients I was seeing a week. I had a full load that was lasting forever with the waiting list. And yet, after a couple of years, I was bored. It was just another practice. I was just going to work. I was just doing what I was doing, and my patients loved it. But there was something missing for me. And that's when somebody suggested I study acupressure, which I did. And they went on and studied reflexology and iridology. And then the man I was studying with at Amherst suggested I work with his mentor, Iona Teagarden, who created Jinshin Do. And I just kept on going. And the more I learned, the more excited I became and saw how our spiritual belief systems of life is hard or life is a struggle impacts our emotions. It causes us to feel dejected or angry and out against the world. And how whether we did that in feeling dejected or aggressive, how that impacted our physical health. I couldn't get enough. I just couldn't get enough of this because it was absolutely amazing to me to see this connection that our spiritual beliefs, how we perceive the world, how we perceive life itself, impacts emotions, which impacts physiology. From there, I went on and studied for 4 years with Barbara Brennan in Long Island. This is many years ago. Her school was in Long Island. And the transformation, the personal transformation, and how I saw my own life story, and how I saw my role in the world, and how dramatically differently my practice was, because I put a massage table in my office and started practicing energy medicine. And for 6 years had no malpractice insurance, because at that time people in my field couldn't touch our patients. Until now it's all transformed, it's changed, it's now called body-centered psychotherapy, and we can do that. And how life has changed so dramatically for me that this has become my passion and my joy, that even if I'm not discussing energy medicine per se, and I'm speaking about stopping to survive and starting to live, it really is all energetics. Everything is energetics, and it transforms the life of the practitioner. And really, I know for me, and I know for many of my graduated students, it's really wanting to go out and change the lives of so many others. Because when you see your life transform dramatically, how can you not want others to have the same gift, the same benefit?
Right, so professional journey in using energy medicine in your practice. And I'm just curious if you could share a little bit, must have been applying it in your own life, and did you see a shift in yourself personally that coincided with this training and understanding that you could share?
Oh my God, that's a 6-hour conversation, so bringing it down to 2 minutes. How it transformed my life was really putting my story in a completely different perspective. And friends and I would laugh. You know, when I was young, I was from an orphanage, and I was adopted and raised in the housing projects of South Boston. And I was not wanted. My grandmother didn't want me in the home because I was illegitimate. I was from an orphanage. And so I was left outside at 5:30 in the morning. My adopted parents would get me up and put me in a playpen out by the front stoop. I'd be 3 years old. And they would leave me there until 9:30 at night when she went to bed. And they'd come out and get me, summer, winter, whatever it may be, and bring me in and give me dinner and put me to bed, and then get me up and out of the house again by 5:30 so that she never saw an illegitimate child in her home. And my girlfriend taught me, when we were starting this whole world of energy medicine, she said, just think about it. When we change our view, our perception of that story, she says, I can see you at 3 years of age in this playpen calling everybody who walked by over to talk. You became a public speaker at 3. And we could then start to laugh at what was a horrific story, but see, I can understand that. Yeah, becoming a public speaker at 3 years of age, it was my way of connecting with others and really learning and growing. And that whole perception of shifting the eyes with which we see the story can really, because if you're balanced and you're out of defense, you're out of wound, you're out of fear, you're out of anger, you can see things so differently. To me, that is the gift. I mean, you acknowledge what is. I mean, that was unfortunate. Any child should be left outside summer or winter because of any situation. But when you can look at it from another perspective, there's a gift in everything. And I think that the ability to see that and to discharge from the drama, you can see the humor, you can see another perspective. And it certainly has been a part of my life in looking at so many stories and letting go that we were all walking a journey. My grandmother was, my mother was, my father was, and all my brothers and sisters. And you can see things so differently, and why not be at peace rather than spending your life in wound or in anger or in the illusionary victim stance. Life's too short to be miserable.
Absolutely, and I know on another day we'll be able to go much further into your own story, but I mean, just hearing that, when you said as a 3-year-old you were out all day in the winter, my heart just sank. And then when you said, and I was a public speaker at 3, I laughed and I'm thinking, right in that moment, you shifted my perception and how I felt
Right. And so as you go back and you look at your own life, think about how that can
even in
change
my
your
own
story.
body, just
Yeah.
hearing how you shifted it.
Right.
Exactly. Well, I know we have only scratched the surface here. I mean, this is such a powerful and deep topic, and actually there will be more webinars on related energy topics throughout the summer. Those folks that signed up tonight for this webinar will now be hearing about those, so there'll definitely be more to come, but I know that a lot of people are probably having questions right now, and they're thinking, you know, I want to know more about this. And on a personal level, things like how just a few energy medicine insights and techniques can change your life, or how you can use it to transform relationships and heal old wounds like you were saying. I mean, gosh, Dorothy, those are deep wounds. And for someone like you to be able to heal those types of wounds, just imagine what's possible for all of us. And not just that, but I mean, when you're tapping into your purpose and passion, and you can have that, you know, really high energy throughout the day. And also, as we were saying earlier about positively influencing, you know, those in our lives, more here that we can explore. And also on a professional level, there are things, next slide, you know, how can I use energy medicine to further my career or to address issues that I have on a professional level? Can I bring it into if I'm a practitioner, how can I bring it into I probably have these, and that you haven't other people know about, because those are the kinds of questions that you're intensive can address. So got a one day over the course of the summer. What someone can experience on that.
My goodness, there's so much people could experience that in that one day we could make that so much. There's so much to be offered, an overview of so many things, looking at the emotional, spiritual, and physical components of the chakras, looking at the meridians.
Can you hear me?
I can hear you slightly. You faded out for a moment.
Oh, okay. I'm sorry. Did you guys hear my question, or should I repeat it?
Oh, repeat it, please.
Okay. Just let me know the last thing you heard so I know where to start back.
We'll just start with the question and we'll go from there. You were talking about the one day.
Right. So I was saying that you've prepared a one-day energy medicine intensive because you have so many people who are looking for answers to those types of questions, and you've been getting so many
I guess we're having a little bit of technical difficulty with Michelle's mic. Dr. Dorothy, if you want to go ahead and talk about your one-day energy medicine intensive that you're going to be having soon.
I would love to. I put together the best of what I could offer, and it really does look at the three levels of existence, the emotional, spiritual, and physical levels of existence. It looks at the chakras and the physical, emotional, and spiritual components of the chakras, And what I would be doing also is offering 2 different methods of hands-on healing that I've developed. So as an introduction to, and then really supporting the entire body being in balance. It really helps, you know, you'll be working with, people would be working with one person and then they work on you, and you really get to experience as well as practice what it feels like to feel energy flows going through the body and to understand the impact of energy on your worldview and on your body. It really is a quick overview, but that is so immensely inclusive to support people just coming alive and understanding what this journey is all about.
I can see here that the Energy Medicine Intensive includes quite a bit of seminars here, introductions and overviews and hands-on techniques. Can you talk a little bit about that?
Certainly. I'm trying to break it up between, so people aren't just sitting down and listening. Going into my passion comes out, so you certainly would get to experience my passion, and looking at, as I said, the emotional, spiritual, and physical characteristics of the chakras, and looking at what happens when any one of those are blocked and how they work with the other. So one impacts the next and so forth. And then there's a way to balance the brain, the left brain and right brain, so that we really get to have the benefit of both. We really get to have all of the artistic, creative skills of the left side of our body and the right brain, and how left brain, looking very logical and analytical, how to balance those out so we don't get to have just one trait fully developed. And then there really is the discussion on energy and how it impacts your life and is so transformative. And then I do love to read, so then we will have lunch, obviously, and in the afternoon, as I said, the 3 levels of existence, and looking at the Hara, the core star, and looking at our personality. So many people, unfortunately, are confused and believe that we are our personalities, and we're not. Personalities is something we develop in order to fit in the planet. We are so much more than our personalities, which is what makes us distinct and unique. We are truly embodied souls with our own particular journey that we're walking and our own purpose in life. And our personality shifts and changes. Hopefully your personality today is not what it was 10 or 20 years ago, that you've learned, you've grown, you've learned from mistakes, but also learned from watching others, traits you wanted to develop in yourself, and you have. And so by the afternoon, with all of this awareness, that's when you'll take a look at how does the energy flow in your body, where is it stuck, and learn that from having somebody work on you, and then learn what that feels like as you work on somebody else. It's a fun introduction to the world of energy medicine.
Well, that sounds fascinating for everyone here that would love to implement this into their life, into their business. And we went over and talked about how this would affect you as a practitioner, or even if someone you want that you care about and you want to learn energy medicine as a caregiver. We want to invite you to this live one-day energy medicine intensive that Dr. Dorothy's having near her hometown. I don't think she's figured out quite the location yet, but it's somewhere near her home of Essex and somewhere in between Branford, Connecticut and Mystic. For only $85, you can learn all of the things that we just went over in a personal, one-on-one intensive with Dr. Dorothy. We have 3 convenient dates to choose from: July 26th, August 16th, or September 6th. If you'd be interested in attending this up close and personal energy medicine intensive with the wonderful Dr. Dorothy, to learn more about how you can implement all this energy medicine into your practice or your personal life, you can simply register over at drdorothyct.com/intensive. You can see the link down there at the bottom. Michelle, do you have anything to add to this?
Can you hear me okay now?
Yeah.
Oh, okay, great.
We thought you were abducted by aliens there.
Well, I have to say, I mean, to have a whole day and lunch, and it's only 80 and more than that on an hour-long massage. And so I think that I mean, what an incredible opportunity and value to have a full day immersion to get all sorts of different types of learning and techniques, and to assess if this is something you want to even do further.
Poor Michelle. She keeps getting abducted into the Bermuda Triangle, but that's the power of the internet here. But obviously, $85, a fantastic opportunity to learn so much about energy medicine and to put this into your life, your practice, and just make it a part of your life, a part of your healing. It's a fantastic opportunity. Dorothy, do you know exactly where it's going to be, or are we going to contact people when they sign
We'll be contacting. We'll be contacting. I'm working in conjunction with Mercy Center to see if we can hold it there. It's a beautiful place right in the water in Medicine, so we're trying to check that out and confirm the dates with them. If not, it'll be something equally beautiful. It truly is one day that we've put together to try to bring as much of this overview and yet have great in-depth and personal touch of what energy medicine is, so people can see the enormous gift that's available to them. All they need to do is open up to it and take a leap, take a jump. I really believe in trying new experiences and take a risk, come alive. If your life is more surviving than living, this is a day in which, in looking at your own energy patterns, and you have the option to really learn how to just jump in, come alive, and live your journey fully. And as a practitioner, how to expand so that your practice is everything you would want it to be.
Those are beautiful words and fantastic, powerful words from such a fascinating woman. If I lived a little closer, I'd be going to this. I live all the way in Virginia Beach, but I would love to come up. That would be wonderful. Some of my favorite places are along that shoreline, and I would love to learn to put energy medicine to use in my life as well. I would like to open up the lines to some questions here. We have a couple from Jean. If you have any questions that you want to ask Dr. Dorothy about energy medicine or anything we went over tonight, or about the one-day intensive, feel free to get those in. But I do have a question from Janine. It's a rather long one, but she says she managed to get herself to work into the work she loves, and writing is one thing. She recently published a book. Good. Great job, Janine. I thought this would open a door that seems to have been closed. So far, it hasn't changed much of anything. My goal is to do what I enjoy and make enough money doing what I love and live comfortably. Things have stalled once again. Why does it continue to be such an effort to make her life what it is? Do you have any advice for Janine, Dr.
I sure do. Janine has come a long, long way from where she was, and I think taking a look at where she used to be to where she is today can right there give her an understanding that she has come quite a distance that she may lose sight of when she keeps looking at where she wants to go. But to address the point she's talking about, that why does it get difficult? I think because what happens often is that when we have a vision of how we want things to go, we can have a very clear objective that this is what it's going to look like and this is what it's supposed to look like, when sometimes what happens is that we're exposed to other realities and we're being asked to look at our objective in a different way. We're being asked to expand how we want to do this, and there may be something else for her that is combined with her writing. And she's written this book. How does she want to promote that? Is she doing anything to get that book out there? Is she offering any afternoon sessions? Is she taking it to different organizations who may benefit from this? What groups does she want to reach? Are there groups that she could go in and speak about her message and bring it out there that may end up purchasing her book or asking her to come in for pay to do something else? She's being called. Sometimes when we go, we've reached the limit of where that is, and we have to regroup and look at how do I more pragmatically bring this to the next level.
That's an excellent answer. I mean, I could use that advice myself for the things I'm doing, and so I really appreciate that answer. She also has a second question that says she's caring for a young woman with degenerative neurological disease. and she only has about 5 years of life left. So she decided to recently stay with her for that period, and it's a fascinating challenge for her, but it's exhausting at times. And from what you've said tonight, is she setting herself up for a negative physical outcome?
Yeah.
She says, I'm overweight and mostly doing the wrong caregiving. How do I protect myself and give her my best effort?
Stepping back a moment, if what you wanted to do was take this book and your message in a book and take that out to the world, how is it that you become a caregiver to this woman? Are you the sole caregiver? And if you're the sole caregiver, why? And have you considered hooking her up with other folks, whether through an agency, through Medicaid, through insurance, through whatever, to support you? Or are you jumping in and becoming a victim and a martyr in this process? Always supporting others is a gift. I think that's part of why we're here. But how are you doing it, Janine? Is it you giving up everything that you dream of and then wondering why it's not present in your life? Are you doing this as an adjunct to walking your dream? Or are you really doing something that you're doing out of obligation rather than out of your heart being opened? It's important to take a look at that, because giving you up in order to care for another is not what this journey is about. Living your dream while you're supporting somebody else is what it's about. So really reassess. Have you fallen into an old pattern? And if so, it's going to be very difficult living what your heart is calling you to do.
That was a beautiful answer as well. Janine's very lucky to have you here tonight and very lucky to be on the webinar. Kathleen, one of our attendees here, has a question. She says, hi, Dr. Dorothy. I'm not in an energy healing business, but can I still attend the one-day intensive? She'd also like to bring her daughter, a 21-year-old college student who spends lots of time with young kids and has a personal yoga and meditation practice. She'd love to bring her as well. Can you address that?
It would be absolutely phenomenal for your daughter with her yoga and other practices. This would help her really explain her work and give her classes from a far more integrated, holistic way. And you don't need a practice to do this. This one day is not at all about needing to have a practice. This is open for anybody who truly wants to come to understand themselves, how their energy works, how they get in their own way, and how their personality impacts their health. Because there are aspects of our personality that we can change. Remember, we are not our personality. And if you understand that, just as I mentioned to Janine, if Janine gives herself up, I don't know the whole story, so I'm just making this up at the moment. If Janine were to give herself up completely and go into victim, she would be setting herself up for various diseases. So to step back and for you to come to this day and learn about it, learn about you, learn about how you use your energy. Do you support your health at every level or not? It would be exciting to have you come and to bring your daughter. What a great day to do together as mother-daughter. What a great gift.
That sounds like a wonderful opportunity for her. So it's about 9 o'clock and we're almost ready to get going here. So get your questions in if you have them. Greg has a question. He says, do you need a level of natural empathic abilities to do this kind of work, or is that developed in the training? It's a good question.
Both. Both. I think you already have a naturally empathic ability. You may not be connected to it, but you've got a heart, and the heart is meant to love. That's what the heart is all about. And so your empathic skills are there whether you're connected to it or not. And this day is really about opening it up further, helping you understand your heart and your ability to connect to other people even more so. We can connect through our knowledge, but until you connect through your heart, you haven't truly been touched. And this day is really about supporting you and making that happen in your life, and certainly in the lives of the people who are traveling with you.
That's wonderful. So if you want to attend this beautiful opportunity to learn energy medicine one-on-one, up close with Dr. Dorothy, hands-on and personal, it's only $85. And we have 3 convenient dates for you to choose from: Saturday, July 26th, or August 16th, or September 16th, or September 6th, sorry. And those are all Saturdays. It's going to be on the beautiful shoreline somewhere between Branford and Mystic, Connecticut. Beautiful, beautiful town. And you can register simply at drdorothyct.com/intensive. all one word there, all small caps, drdorothyct.com/intensive. I'm going to see if I can get Michelle to come back into the atmosphere here and kind of wrap this thing up. And,
Technology at its finest.
It always is. It's always. This is why I'd rather come to see you live and having to listen to all this on a webinar. It would just be a fantastic opportunity. So, Michelle, are you back into the atmosphere, my love? Where are you?
I don't know. Am I? Can you hear me?
I hear you now. Yeah. Sorry about that.
Oh, yeah. I'm sorry about that too. I'm not sure why it stopped working, but all I can say is what an amazing opportunity this is, and I definitely am thinking about coming myself.
Come on down, Michelle. I'd love to have you.
Great. Well, Colin, do we have any more time for Q&A, or do we need to be wrapping up here? I'm not sure if we have any other questions on the line.
Let me check for questions here real quick. I have just one more. It says, this is from Susan. She says, can you talk a bit more about these techniques, especially the hands-on work, and how they can be used on yourself, and how it differs when you are self-treating? If you can explain that a little bit.
Oh, certainly you can use these on yourself. The difference is you're not having that intimate connection with somebody else. But you can use this on yourself. You should be doing that anyway. I mean, we need to be our own caregivers. We need to take care of ourselves. So learning how to do this, learning where to put your hands and what your intention is, really beginning to see that your connection to yourself is imperative. Until you really have that connection to yourself, how are you going to connect to other people? And we can only connect to others to the extent that we connect to ourselves. So you can learn these hands-on techniques. It's where to place the hands. It's really to understand what's going on. And our hands are amazing. When you put your hands on somebody, initially you just feel skin. If you relax, you're going to feel the pulsation. You relax even further, you'll be amazed that you can feel an emotion under that, whether it's fear or anger or victim or lost. You feel immense things with your hands, and they really become a tool of self-awareness as well as a tool for understanding others. It's just training. It's you know, if you could think of an interior designer, they walk into a room and you know that you've got beautiful blue pillows, but an interior designer is going to walk in and see that you've got blue-green pillows and the rest of the room is really yellow with a little blue overtone, and you don't even see the difference, but it sticks out to them because they see with the same eyes we do, but they have a perception that's very different. We can learn to develop that level of perception in our hands so that we can, even when we cross our own arms or when we touch somebody, we can have hands that are so perceptive. We feel far more than what the normal person would, just through exposure and through training. It's a huge gift you give yourself.
That's a fantastic answer and a fantastic opportunity, and we want to offer you this fantastic opportunity to come live to see Dr. Dorothy and to learn from her in a personal one-on-one, one-day energy medicine intensive, a retreat, as you will, where you can learn to implement energy medicine into your personal life and your professional practice, only $85, 9 to 5, 3 different Saturdays to choose from. Simply register over at drdorothyct.com/intensive, and there's no more questions coming in at the moment, so it's 9:05 here Eastern, so we're going to go ahead and bid adieu to everyone. If you have any questions at all, and you didn't get a chance to answer them or ask them here, you can always write Dr. Dorothy at drdorothyct.com. That's her email, and she'll answer any questions that you have if you didn't get a chance to answer them here. So again, this will be recorded, and we're going to be sending it out to everybody tomorrow. So I really enjoyed being here tonight, and I really learned a lot. And so we're going to go ahead and get out of here. Michelle, any last words?
I'll just keep it short and say good night, since I've been having some technical issues here. Thank you, Dr. Dorothy. It's been a pleasure chatting with you, and I really learned a lot. I'm sure the audience did too.
Thank you. It is a joy. I love this work. So it's an absolute joy for me to be here and share this with you. And really allow people to begin to see that there's so much more to life than we see with our eyes. Life's meant to be an adventure. We need to start living it and living it fully. That certainly has been my way of life. And thank you so much for attending.
Thank you so much for being here, Dr. Dorothy, and giving us your time tonight. And I want to say thank you for everyone here's time tonight. And so we wanted to make sure that you learned something very valuable tonight. Don't pass up this wonderful opportunity to meet and work with Dr. Dorothy personally at her live one-day energy medicine intensive. All right, there's going to be plenty of webinars on different topics about energy medicine coming up in the future, so keep your eyes out for those emails, and we'll have a great night. So good night, everybody, and we'll talk to you soon.
Good night.